they said, try this medication, try this hormone therapy, I was just willing to do that versus leaning in, I think, to like emotional and the trauma-based reflection of that than the what foods can I do?
We have really come a long way, you and I. This is your 19th pregnancy, but not your 19th child.
Correct.
Which gives you a bona fide labeling of baby maker, but we want to know more of the details, right?
Yes.
So you can fill in the blanks for me because my memory is a little foggy, but I did do a case study of your case when I was working on my doctorate.
Okay.
And at that point, you were on pregnancy number 16. But let me go back in time to when we met. It would be 2011. And you were, I think, 28 years old.
I was.
Yeah.
And I had just experienced my third miscarriage and my first D&C.
Right. You were 28 years old, and I met you after that, and your cycles had become irregular, or you weren't bleeding after that. Is that correct?
My cycles my whole life had been irregular, so that wasn't new, but I just had not yet gotten my period back after that D&C. And that was after having been on 3 cycles of Clomid, no other hormone therapy, but 3 pregnancies that were very close back to back.
Were those first 3 Clomid mediated?
They were.
They all were. So you had been having trouble conceiving in the first place without Clomid. And do you think that now I remember meeting you and you were a dance instructor and a dancer.
Yes.
Like all kinds of things. And you were thin. And I remember thinking, okay, we just got to first clear the hurdle of we need to put a little bit of weight on and then we can have more estrogen and that will skew things in the right direction. But there was resistance to that, which is common, right? But we ended up using herbs and a little bit of food because you weren't really open to the idea of gaining any weight, but you were okay with herbs. And we used herbs. And then you conceived 3 times, I think naturally without any ART, because we were able to regulate your cycle. And so it was like the acupuncture nerves are working, but they're not quite working because they were affecting the hypothalamus and the pituitary and the ovaries and the timing, but we weren't addressing, or we couldn't solve the case of what was causing the losses. And then we talked about the seed program, and you were willing to be filmed sitting in on the class that's now the movie Fertile Thoughts. And as it turns out, there were, I think, like 10 women in that class. And within 6 months, all y'all were pregnant and stayed pregnant. And I thought it would be you who would be the first.
Because I was the youngest.
You were youngest. You were only 28. And you were actually number 10 of all of them. But you did it within 6 months. It was like 6 months from doing that. And I think we filmed on your birthday or something kind of funny.
That's
so
funny.
It's like, wow, this is a cool thing. And you gave me that Saturday. So anyway, so Aiden would be live birth number 9, right? Or 8? We had
of my pregnancy. Oh, he would be number 7, I believe.
Yeah. So Aiden would be pregnancy number 7. So there were the 3 and then the other 3. And then you did the seed program. What did you think of that? That's totally different from what you were trying before.
It was very different because before that, I was just very dependent and trusting of whatever reproductive endocrinologist I was seeing. They said, try this medication, try this hormone therapy. I was just willing to do that versus leaning in, I think, to like my instinct and leaning into this like natural thinking of the mind-body connection of the brain and the heart to the uterus. And I know you always say that the uterus is your second heart. And really like, I think I was more resistant to that hard work, the like emotional and the trauma-based reflection of that than the what foods can I do? Because the foods felt like, oh, that's something I have like actionable steps that I can easily come up with an action plan and follow. Where the emotional part, it was very obviously vulnerable and emotionally hard to really go and acknowledge some things that were trauma of the past and all of that. On top of already having like grief trauma because of all my losses, right?
Yeah. Right. And I remember thinking, it was almost like we were arm wrestling to do that emotional work, and you didn't want to do it. And I just had to allow you to do it in your own time, in your own way. And I remember one of the first clues that this was going to work out is you showed up at the clinic with a journal.
That's funny.
And that would, I guess, be after attending the live class. What made you decide to commit to doing that?
That's a great question. Well, so by the time the live class and the filming happened, like you said, I had 3 other losses. I had also then started seeing Dr. Beck, who had diagnosed me with a uterine septum. So I had gotten that corrected. And I think after I got that septum corrected, I naively thought, everyone keeps telling me I'm young, it's going to happen. And now we figured out this roadblock and we fixed it. We got rid of the roadblock. So this is going to open up, all the struggle is going to be gone. And now I'm going to try this food stuff and that's fine. And I was still resistant though to like the emotional healing aspect of it, thinking it didn't matter. Or maybe I think deep down I knew it would matter, but I didn't think it was the end.
Yeah, it wasn't going to be the domino push.
Correct. Yeah. Exactly. Which ultimately now, fast forward 14 years later, I actually realized that was the most important of the trifecta of septum versus nutrition versus the emotional healing.
Yeah, it was. And we had some moments in your case where things turned and it became obvious to me too. Like I assume that all women are going to be ruled by their emotions, right? And I saw you as a tough nut to crack for sure. But what I also saw was one day hubby came to pick you up or something, and I witnessed just like tension between the two of you, which would be expected. But something like my intuition kicked in and said, change the herbs. We were tonifying you, and that was great. It got you regular. But when we switched it to make life more comfortable, address the circumstantial depression that's resulting from trauma and loss, recurrent miscarriage, and all of that, right? So,
and I actually vividly remember that interaction of having my husband come into that, be part of that session. And that was big for him to even be open and vulnerable to desire to, and I think that was, in a way, a little bit of a game changer in trajectory for both of us and how we viewed the journey that we were on together. Because I think before that, it was very much, it felt like this is my journey. And he just happens to be part of like a character of this story that's my story that's unveiling versus it's a journey that we're both on. We have different lenses of this journey because we're experiencing it as different characters, but we're both ultimately on this journey together and on the same team.
Yeah. Yeah, you are. And it became more and more over time.
Right.
Even,
right.
I don't know the age difference of you and him, but if I met you when you were 28, is he older than you?
He is just shy of 2 years. So about a year and a half. Yeah. So we're roughly the same.
So you were both, in your family building era at the same chapter of life. And so we know that men and women process this very differently. Women talk about it with all their friends and they heal by talking.
Sure.
And the men, well, what do they have?
Right.
Nothing.
Right.
And that's starting to become more of a conversation point for the male factor in fertility. But it's going to be a while before they're talking about it. But even without the talking, there at that time, there was not male vitamins really or antioxidants as the cure. And I think, I don't know, I assume his sperm was tested, and was there a sperm male factor issue that Dr. Beck uncovered?
His sperm was tested multiple times. As throughout my journey, we both had almost similar tests done multiple times because it kept my womb kept changing once the septum was gone, or I'd have polyps. So then we'd start again of let's test sperm again. Let's do another water saline ultrasound, things of that nature, because we were dealing with a new climate, so to speak, in the womb, right? And so wanting to, from that Eastern medicine mentality, wanting to just make sure all of our ducks were in a row versus assuming they were the same from, prior years or whatnot, or prior pregnancies. So his sperm did didn't come back completely normal. And my uterus also, through all these tests, came back ultimately like somewhat normal once the septum was released, aside from some polyp things and things that had kind of developed, but nothing that should have
Right. So I
resulted
remember
in these losses.
From reviewing the case, there was the conversation of you saying, I think I have a clotting factor problem. And I think that was dismissed or ruled out. Right?
Yes, that's true.
And it was not ruled out. It was at first dismissed and found out later, or did you have a clotting?
So are you talking about the immunology?
There was
testing?
There was the immunology, but there was specifically a question about checking for clotting, like the killer cell.
Oh,
the
right.
natural killer assay.
The natural killer. Yes. So we did go through some testing, immunology testing for both of us to see if that was potentially what was causing all of this. It was dismissed through some of our practitioners that we were seeing at the time as like, no, that's not the issue. Don't waste your time on that. Not in those words, but that's what it felt like. But again, I was at this point where it felt like, but no other tests, no other things were showing a reasoning. And I really wanted a reason to be able, again, to go into like action plan mode, which is how my brain works. And so, and then what came out of that was we ended up not actually pursuing it, just we decided not to for various reasons. And I think at that point, I just felt very defeated.
So you knew that you wanted to grow your family. And these tests, we're talking about getting the test done and gathering information, because then you could utilize your brain, your problem-solving skills. But there seemed to be no answer.
Right. Exactly. Because here I was, I had really implemented I leaned into the seed program and whatnot. I had started at some point leaning into Danica saying you need to do the hard work and heal your heart. That's going to heal your uterus.
And so that looked like you have your journals here.
I do.
Yeah. So I remember us putting, yes, I remember that one.
You do? That's so funny.
Remember. Yeah.
I mean, I have like Post-its of like nuggets of Danica in sessions. I felt like I could never write fast enough afterwards to try to reflect on what was being shared with me. But,
it's just really interesting to see the way that your brain works and the way that you decided to I don't like the word attack this when it comes to talking about baby making, but the way that you decided to approach it, right? Like you realized, okay, what I can control is maybe saying some mantras or affirmations.
Correct.
Changing the way that I'm reacting and integrating it differently.
Do your pads still look like this, or are these like old school?
Yeah. I do still write notes, but now I send them in email.
That's so funny.
When I'm giving instructions or grief stuff, the sentence prompts, I send them as in the email to the patient.
Yeah, I think this was also a super game changer. This was a multi-session experience of asking you for me to like reflect on.
So for the listeners,
yes,
what you're alluding to or mentioning is this grief recovery work that I learned from my therapist, Debbie Frankel, who's coming on a future episode.
Oh, great.
And she was associated with the Grief Recovery Institute in Sherman Oaks here in California. So it works by like unfolding the timeline, personal history, and identifying where other losses occur. So then we can realize that infertility isn't just this thing that derails you all on its own. It's because all this other stuff has happened along the way. Right. And then it becomes just like the last drop and things get really messy.
Right.
So you were in my office and you were learning all of these tools. So then you come home, did you just like tell Josh, hey, you got to do this? Like what, or he was like, how many journals, babe? Like, what did it look like at home? I'm just curious.
Interesting. At home, it was me in my own sort of zone of trying to go through this. And I think going back to that idea of grief is that I was not just grieving that I was struggling to have a child. I was grieving that my body wasn't working. As a dancer my whole life and as a dance educator, I learned how to manipulate my body to do these like outrageous things and shapes and moves. And here I was not able to manipulate my body to do what seemingly should be so natural.
Well, that's an innate part of being female, right? We have a uterus. We want to use it.
Right. So it was grieving that my body wasn't working, grieving that I wasn't, my plan, A-type personality, my plan wasn't coming to fruition, grieving not just that, but then the losses of these babies.
The loss of the dream.
The loss of the dream.
The loss of being able to believe that it was going to work.
Correct.
I would imagine that was like really, because you were so young.
Exactly.
You're only going to get
you're
older.
So young, it's going to be fine. And it wasn't.
Well, and you were only going to be getting older, which in this particular part of medicine, getting older means actually becoming less fertile.
Exactly.
But for empowered individuals who are willing to do the work, getting older means getting wiser, means becoming more fertile potentially. Right. We don't want to oversell, but
Because at this point, we had talked about how I had 3 miscarriages before us connecting, 3 more before my eldest Aiden was born. And then I had another 3 before then. Now we go into the shift of.
So we should, before you go into those other 3, let's talk what do you believe now that Aiden is 12, 13?
11.
Okay. Now that Aiden's 11, you've had plenty of time to reflect on, especially since you came back and we were trying for live birth number 2. We'd spent so much time trying to figure out what made it work with him. What do you think now? Right.
No, it's true. And I remember having conversations also with Dr. Beck, because it was a, how did this happen? Because I had a miscarriage. This before my pregnancy with Aiden. I experienced a miscarriage that my body naturally released, but my hormone levels were not coming down. And so Dr. Beck encouraged my husband and I take a little break from this. We had many pregnancies. We had many procedures, including a septum removed, starting nutrition. Like there's just a lot of changes that we were trying to implement at once. She's like, let's just take a beat and see what happens. Naively to me, I thought she just meant take a beat from doing all these things. I didn't realize I was supposed to be having protected intercourse.
Oh yeah. Right.
So
right.
I ended up in her office for a blood draw, waiting for my numbers to go down, and my numbers spiked up.
Yeah. And remember, your uterine lining was thin.
Exactly.
And she was nervous and she was like,
and so she said,
abstain.
Exactly.
Yeah, too late.
Yep. Too late. So because of the sort of interesting scenario of that, there was no way to replicate. What did we do to make
we did everything wrong.
Yeah, exactly.
That's what you and I were joking.
It was anti-science, basically.
We were saying we didn't, the things that we thought we could control, they got out of control. Right. So
now in reflection, again, I keep bringing back that I agree. I acknowledge I'm a type A person who likes to have an action plan. And I think in some ways it was like that out of control needed to happen for it to for that action plan to not work, for it to work. It's like
the pathway for Aiden to get in there. Because, in Stick It To Me, Baby, there's a chapter about letting go. And letting go is about holding too tight.
Right.
And what's the appropriate amount of holding to do? How, I think that goes metaphorically with the fallopian tubes. Clenching can be like just bracing for another miscarriage, or
100%.
How hard it's going to be to conceive, because everybody's struggling.
But I do have this post-it in here that I refer to all the time. Where is it? Here it is. To have committed detachment.
Yeah. Committed to the process of family building, detached from how and when it happens, right? The details.
And I feel like I use that mantra not just in my family building, but in life, right? Yeah. It's like a healthy, for me, who is such a hold on tight, control, manipulate everything. Yeah. It's a good reminder that releasing that.
Yeah. Well, and you said it a few minutes ago, dancing and choreography and controlling and creating a dance, right? And that needs to be very controlled. But in baby making, that doesn't work typically.
Right.
And boy, have you learned that lesson, right?
Right. Exactly.
So I don't think we finished talking.
Oh,
I don't think we finished
post
like
Aiden.
or pre Aiden.
Oh,
What was it like at home with both of you? Like, so you said that you just kind of walled off and got in your own lane, and you were like, okay, inner work, doing it by myself. What was Josh doing?
That's a great question. Our personalities in those sort of moments of despair or low. Mine is I want to go in internally, do my thing, where his is he wants to be even more out and social to feel connected to the world around him and feel, because he feels very rejuvenated by being around other people. And so it kind of was those obviously are very opposite.
Yeah.
And so it would then turn into quite a bit of conflict because, I'd be grieving in my own way. He'd be grieving in his own way that was very opposite. And I felt like at the time, I felt like, wait, you're not understanding that this is my need and you're devaluing what this grieving process is. I viewed it as you're going out to be social because you have the option. Your body didn't go through anything traumatic right now. So you have the option to go out and do that, where not only am I having to grieve the emotions, but also the physicality that happens in that recovery after losing a pregnancy.
Mm-hmm.
And the interesting thing is multiple losses later and therapy later between the two of us realizing no, that was just what our needs were. And it's okay that our needs were different, and really highlighting there were times when, even though our needs were very opposite, there were times of them coming together, and that was kind of how it needed to be, and that was okay in that trajectory, that ebb and flow of away and together didn't devalue what either one of us was feeling. Yeah. And the fact that he wasn't physically experiencing a loss doesn't negate the fact that he was still experiencing something out of that loss.
Sure. He was experiencing this loss of what he was hoping, a relationship that he was hoping to have, and also experiencing that he's powerless in being able to help you. And for a masculine part of the partnership, that's really, really hard. So, my goodness. But then we put in those herbs that we joke, it's called Chinese Prozac, right?
Yes.
We put that in. And then did you come more out of your shell, meet him in the middle a little bit more frequently? Or what do you think? Do you remember? It's been a long time ago.
I remember those herbs.
Okay.
I remember coming to the office for those herbs when I was like, oh no, I'm out. Yes, I think that it was a game changer for sure.
So it made you more accessible to him so that he wouldn't feel the need to go out and be socialized. Like the two of you could discuss it together.
Well, and I think because it was more that I was the one that was pushing away, because I felt like this is my space.
This is happening
you
to
don't
me.
understand, right? So it made me more available to him to realize, no, he's having his own journey, and he's allowed to grieve how he needs to grieve, and what that looks like and what he needs in those moments might be different than mine. And it doesn't mean that it's any view on how he wants to support me. And so I think it was really an important lesson for us to learn. But
did you guys do any therapy together for this?
We did therapy. I did therapy individually, and we didn't actually do couples therapy. That really all of this sort of understanding of that journey until we were in COVID. So this was now multiple miscarriages later that we did it. Okay. So we'll get there, I suppose, later. Right. But it's important to note, because I think we were able to still go back in time and heal those moments and realize the growth that had come out of that sort of what seemed dark time.
Yeah. Yeah. So here's this thin uterine lining.
Yes.
Here's this, oops, too late. We already had some sex. And you're taking good herbs that are changing the emotional milieu. You're getting acupuncture, and you did the seed live, and you were sitting in the audience, right? And your friend was in the audience, and she was pregnant, obviously, or had been. So yeah, she was. So you were like everything had changed, which is something that I tell my patients even now. And it's so important. If we can change the beginning, then it stands to reason that we will change the outcome. It's when they're doing the same thing over and over and over and not changing anything. That's where therapy can actually work against them, because they're just massaging the same, like a family of origin stuff or whatever. So unless you're working with somebody who really specializes in maternal mental health or fertility specific, like it can like not be as helpful. But in these rooms, I'm not a therapist and I can talk about whatever. It's very freeing. So I will remind the patients of the different things that they're doing now compared to what they've done in the past. And it's just to give them something like to hang or to like think why it might be different, to calm that anxiety. Right?
Right.
So here now, everything had been changed.
Yes.
And then
changed again.
Well, so remind me when you got that test. So then we had every time you would get pregnant, then we were all kind of nervous because we didn't know like how many days.
I was waiting for that ball to drop.
Yeah. Is it going to be days? Is it going to be a couple of weeks?
Right.
Like
exactly.
What's going to happen? Because
how is it going to happen? Am I going to start bleeding?
Yeah,
or is it just my numbers are going to stop increasing?
And
is my body going to naturally release it, or am I going to need to have a DNC?
Right.
Mm-hmm. But you go back to this, when I found out I was pregnant with Aiden, I actually didn't realize I was pregnant with Aiden. And I came to see you because my numbers weren't coming down. And I was like, we need to speed this up.
Which numbers are you talking about?
My hormone numbers after my 6th miscarriage and trying to get pregnant, or Dr. Beck telling us we need to take a break.
Yeah.
And I remember being in your office and you were checking my pulse and you said, "Are you pregnant?" And I said, "No, I'm on a break. What are you talking about? I'm not pregnant. There's no way."
Right.
And so we did our session. And before I walked out the door, you said, "You need to go home and take a pregnancy test." And I remember thinking, this is bonkers. It's going to come back positive because my hormone levels are still risen. Like, why would I take a pregnancy test? And
the lining was at 5 millimeters.
It was, yeah.
It was like
there was no,
it was early in the luteal phase.
Exactly.
It couldn't even been,
exactly.
It wouldn't show up, but it,
exactly.
Okay. And so
I went home and I took a pregnancy test. It came back positive. But again, I assumed it's positive because I still have HCG in my system from this miscarriage of 6 weeks ago that my body's trying to still figure itself out. Went to get a blood work done. I remember Dr. Beck's nurse calling me and saying, "So your hormone levels have risen." I'm like, "How did that happen?" Like, I don't understand. This is like completely against science or anything that I've been like working on. Of how this is supposed to go down.
Right. But I remember the lining being so thin, so the urgency was put on some estrogen patch stat.
Yes.
Right? Like
I went on basically everything.
Yeah. And then we were
hormone
all
therapy central.
Yeah. And because we'd never seen that happen, seen this situation happen, we just all were like, hurry, rally, support, hold.
Right.
So probably stayed on herbs. I think we did the added flavors. I'm not sure.
That sounds right.
That one, 8 treasures, who knows? But I'm sure we came back in with the tonics. But like anything we could do to support that.
Right.
We did. Right. And I don't know if you did any bed rest or anything.
No. I was still teaching. Well, at that point it was during the summer, so my teaching was less. So I guess in a way my body was less stressed.
Yeah.
Right. By default, of circumstance default.
But yet another change from overworking, overdoing, overmoving.
Right.
And so the lining responded to the estrogen patch. She would have given you some progesterone suppositories, right? And you kept coming in for acupuncture. And lo and behold,
then 12 or 13 weeks later, she was graduating me to my OB. And I was like, no, I'm not ready. I don't want to do another change. Like, this feels so comfortable and I'm settled. And
And the part in you that likes to succeed saw numbers doubling, heartbeat scan and continuing and all of that. And then would have been like normal genetics and stuff. So, okay, so that's little Aiden Chase.
Yes.
And then...
And his middle name we chose chase because we were chasing this dream of starting a family.
Oh, that makes so much sense. Then you started chasing the little boy, right? So how old was Aiden when you decided to come back for his sibling?
Good question. I believe he was around 2-ish. I decided I wanted to come back and start because, again, I felt like, I defied science. Like all of my struggles are going to be...
I can do it again. Now my womb knows what to do.
My womb knows what to do. I, leaned into the seed program again, eventually.
And you presumably had a vaginal birth.
So I ended up having a C-section, unplanned C-section.
Okay. So there was something happened there at the end?
Yes. But it had nothing to do with my uterus as much as had to do with him being just a almost 9-pound baby and not able to... He was sunny side up and we were able to rotate him in labor, but then he went at a diagonal and ended up just trying to come out of my hip bone, which obviously was not going to work.
Gosh.
So,
yeah. Okay. Yeah. So positional. And so then you had a C-section. Okay.
Correct.
So that wasn't traumatic necessarily. It was like a decision you had to make.
Right. I think that I did, again, go back to like this grief process. I did have to grieve. That's not how I wanted or what I expected, right? I had a doula. I thought I was going to do this natural birth and it went everything but that.
Right. Yeah. Again, how we process what we get, right?
Exactly.
So then fast forwarding 2 years later, and because I saw you frequently during the pregnancy and it really agreed with you and you didn't have to do like blood thinners or steroids or anything. So it was like, okay, let's do it again. Let's just like try, start with Chinese Prozac instead of doing it later. And it didn't work.
And I kept having losses. And so, on this side of the holistic end, I was doing these Chinese herbs. I was really leaning into the seed program, into fertile thoughts, doing all of that. And by this point, I was very in, right? I was not resistant in the same way as I was in the previous journey. And then on the sort of, Western medicine, I was trying, I didn't do Clomid again, but I did metformin, a cycle of metformin. We would do a cycle of IUI. We do natural.
Why did they give you metformin? Did they think you had PCO or?
Well, my first reproductive endocrinologist with my first 3 pregnancies thought I had PCOS. Dr. Beck did not agree with that diagnosis.
Right. We were talking about that in her episode how women can be given metformin, but in truth, it's that they would benefit from something like Menopur because it's a hypothalamus problem.
Interesting.
And Menopur being an LH and FSH, then to put that in is like a pituitary hypothalamus reset.
I see.
Makes a lot of sense, right? Now, like hindsight is always 20/20.
Totally.
But in the moment, it was like, okay, throw the metformin at it, throw anything you can.
Exactly. And we tried different angles of IUI versus natural but timed. So I would still go in to get a trigger shot and figure all that out. IVF was never really on the table because of how many losses I had. And the few that we did test chromosomally when we were doing DNCs always came back as chromosomally perfect.
So they were normal. Those losses were normal.
At least the ones that we
tested. Yeah, because of your age, the genetics, and his age too. So it stands to reason. And karyotyping obviously was done, right, as part of the standard workup, right? So we could rule that out too. So then these 3 pregnancies post-Aiden looked like chemicals, natural. How did that happen?
Good question. I always lost all of my miscarriage. Has somewhere between 6 weeks and 9 weeks. So some of those pregnancies I saw cardiac activity and some I never got to that point.
Yeah, fetal heartbeat.
It just really depended.
Right. It was hit or miss.
It was.
So random.
So now we're at miscarriage number 9.
Yeah.
And I was physically and emotionally pretty spent.
Yeah.
But I knew that I wanted to grow my family. And I continued to come see you for hormone balance and those Chinese herbs. I was like, I knew I needed. I could feel like intuitionally, I could feel that my body responded positively to them. But we did choose to sort of re-angle and what are our other options of growing a family.
Yeah. what's the best choice right now?
Correct. Exactly. And adoption is something that my husband and I had talked about even before we got married as something that was placed on our hearts.
Aww.
And so we knew that it wasn't we're desperate, we're going to look for this thing. It was more of, is now the time that we're leaning into this thing that we knew we were always going to do. We just never knew when the right time was. And we had made that decision before even knowing what our fertility journey was going to look like.
Which is really interesting. And I've heard other people say that they had always been open to or thought they would do an adoption process. Yeah.
Yeah. So after my 9th miscarriage, we really leaned into that and really educated ourselves on what it means to be a parent of an adoptee and what are our different options in that route. And I felt like I really wanted to learn from my experience of trying to get pregnant for so many years and having so many losses, of not just going into it naive like I had at the beginning of my fertility journey. I wanted to really educate myself and feel like the education that I was receiving that way mixed with my intuition was guiding our steps, because there's so many different avenues for adoption.
So you're the planner in you.
Yes.
And the need to control was really satisfied by being able to look at different agencies, different profiles, or whatever, like different options,
right.
different countries.
Right. What are exactly.
Right? Yeah.
Exactly. Yes.
And
so then we connected with an adoption lawyer who connected us with a birth mom who then chose us to parent her child, who she was due 7 weeks from the moment that we met and from when she gave us.
So she was at 33 weeks approximately?
Approximately.
Wow. And she chose you guys. She must have loved your story.
I think so. I think she felt.
And you, of course.
Yes.
but yeah, that would, if I was carrying one and I couldn't have, and I heard of somebody who had really been trying so much, you'd be a good candidate. So that's Remy.
And so that's Remy.
And what was that like to be handed a baby that you hadn't gestated?
Yeah, it was a fascinating thing because Remy's birth mom at the time lived in Texas. So it wasn't even like, I could go to her doctor appointments and feel part of this last trimester event, even as a observer, right? And I just really used those 7 weeks to really get to know this wonderful woman, because I felt like, should she make the choice for us to parent her child when it was all said and done, I wanted to have as much relationship understanding of this human to be able to share that with Remy.
Oh, that's so sweet.
In a way that, that was just really important to me.
So has she stayed in touch? Did you send pictures?
Yeah, so we are still in touch. It's not a formulaic thing of once a month I send pictures or reach out. We've agreed that I just do it in the sense of when it's placed on my heart that I think of her, I'll send recent 5 or 6 photos of Remy, and she always engages and asks questions. And so there is this relationship in that way. And Remy and her have had video talks as well and things of that nature. So Remy knows that she's adopted. So we celebrate as part of her identity and part of what makes her unique. She has her normal birthday in November, but we also have we celebrate another day every year of when her adoption was finalized. So she has an adoption day celebration as well. It was just a very important thing to my husband and I to really lift that part of her identity up.
Good. Yeah. I think that's wonderful. Everybody's got to do it in their own way.
Sure, of course.
Yeah, and this was your way.
Yep.
And that would be very satisfying potentially for the woman who birthed Remy,
And it's really interesting to be, it's this trifecta. It's like birth parents, adoptive parents, and then the child, right? And it's such an interesting role that I play, having experienced the journey of loss and not able to get pregnant, and also the triumph of getting pregnant with Aiden and having a full-term live birth. Well, part of this trifecta where this birth mom is grieving in her own way, in a different way that I can't understand because I've never made that choice, but I also understand what it's like to grieve a child. And so to be part of this trifecta and part of this story it's not my story in this avenue, right? It's birth mom story, but then there's also Remy's story angle of it, right? Again, I think that journey of everything that I went through prepared me for being able to be like that empathetic support system for all of us in this trifecta. Because I do think of that a lot, that as much as it was so joyous for my husband and I to welcome this child and to parent this beautiful girl, at the same time, there's this woman who is grieving and continues to grieve the loss of a child. Yeah. Right? Yeah. And so those two can coexist, but it's really important to me to constantly remember that and to not devalue what sacrifice was put into this.
Yeah. Like it's really testimony to baby making, right? Like you're the connection point and you being the glue and you allowing Remy to know the woman who couldn't keep her and for you to allow that woman to see that her daughter got placed with such a loving family. You know, that would be like the best worst case scenario, right?
For sure.
Like in a situation where it's just like so many hards, that ends up being a win.
Sure. I do want to touch on this interesting thing is you had asked me what made me come back to you after Aiden was born to like try again. And sometime between when Aiden was born and when I started coming back to reconnect with you, I had a dream. And I had a vivid dream that felt so real when I woke up. And my vivid dream, I was in Dr. Beck's office getting examined because in my dream, I was pregnant in early pregnancy. And the feelings that I felt in real life were in this dream of that. Do I want an ultrasound? Because I'm going to just be disappointed, but I do want an ultrasound. So what if it's a different trajectory and like whatnot, that the like mixed feelings. And typically in those moments, my husband, would be supportive, holding my hand, but it was pretty like a somber environment, kind of like very calm and zen. And, but in my dream, it was opposite. It was like, I was feeling this like nervousness, but my husband and Dr. Beck were as if they were like at the bar shooting the breeze, like chit-chatting with each other. And I remember in my dream feeling like, wait, this is not how it's supposed to go. Like it felt wrong, right? But not wrong in I'm upset at them. I was acknowledging in my dream, this felt like a different shift than what I'm used to. And so, she starts the ultrasound and I usually would not look at the screen until she would say,
it's okay to look.
Or she would tell me what I would expect. Exactly. And so she said at one point, oh, you can look at the screen now, but didn't say what I was going to see, which was not also the typical approach that we sort of had come into. So I took a look at the screen. At the same time, they're still shooting the breeze, like talking about, I couldn't make what they were talking about in my dream, but it was just very joyful. Ease. Yeah. So I look at the screen and it's one monitor, but in this one monitor, it's clearly two triangular uteruses, both with babies in them, and babies that are far enough along where you see the full baby. It's not just this like, the pool or anything of that way. And I'm trying to interrupt their little chit chat saying like, does anyone else see this? Like, what is this that I'm looking at? Someone explain it. And they're just care less about, they're so engrossed in their conversation. And I remember I came to you and I said, this is my dream. Like, what does this mean? And, both of us had different angles of like, it could mean this, could mean that, and whatever. And after I adopted Remy, I thought, oh, that dream was like a indicative to, those were two uteruses. One was mine and one was another woman's. And one baby was Aiden and the other was Remy from another mom who was going to gift me with this beautiful sacrifice on her end. And that dream kept replaying as I was struggling, still having miscarriages, choosing to do adoption. But it wasn't until I was holding Remy in the hospital, literally seconds old, and it like all made sense. I'm like, that dream makes sense, that this is what was supposed to happen. It's like prophecy in a way to what was going to happen 3 miscarriages and an adoption year later, you know?
So Remy is how old then?
So now Remy is 5.
And so the two of them are 6 years apart?
They're 5.5 years apart.
Okay.
Mm-hmm.
Wow.
Yeah.
So what a way to merge in your psyche and the intuition and the dream state into reality, right? And to see it coalesce. That's so awesome. And you can feel like this was divine design.
Yes, exactly.
So I saw you after you adopted her. Because then you were going to try again?
Because then we decided maybe now is the time to try again. And if anything, let me just regulate my hormones. Let me because I do believe that
at this stage, after receiving Remy, how old were you?
Oh gosh, so this was 5 years ago. So I was 36 and a half or so. So I was already like a geriatric, so to speak, right? Mm-hmm. In that terms. But for some reason, there was something pulling at my heart that I needed to keep going.
Right. Some women don't even start until 42 plus, right? So I don't think of 36 as geriatric, but I know medical term.
Exactly.
So you're 36. You now have a full heart and the picture's complete with a boy and a girl and everything. But there was this like nagging sense. So what year are we at when Remy arrives?
Was born in 2018.
Okay. So then we worked together and there would have been some more losses.
There would have been some more losses.
Several. Like 5?
Right before I had 9 losses before we adopted Remy, and then I went on to have another 7.
Right. Because my case study for you was at 16.
And some of those losses I was actually seeing Dr. Beck or seeing you, and some of them I just was not at all. And I would naturally that was the thing. It was like I would naturally get pregnant.
Yeah.
But it was the sustaining that was.
Right. And I want to clarify.
Sure.
Because I have women who have a hunch that it worked, but they don't test it.
I see.
Yours were actually tested, home test or blood test or both.
Both usually. Mm-hmm.
Yeah. They were bona fide, legit pregnancies. Right.
Yes.
So we parted ways when you were at like 16. Gravida 16, Parity 1. That was the name of my case study.
Yep.
So that means 16 times conceiving and only 1. So then what happened?
And so then it just kind of turned into, well, I meant to have 2 kids. Again, I kept going back to every time I had a miscarriage after we had adopted Remy, I just kept thinking, okay, that's just my dream. My prophecy was that I was going to have 2. So why am I trying to keep pushing against that story?
Triangles.
Exactly. Exactly. And so, but I kept, even on some of these pregnancies after Remy's adoption, we weren't trying. Mm-hmm. And even some of them, like it was in the wrong phase of my cycle that I should have even been getting pregnant. And so, I kind of had a hunch, like maybe I'm starting to enter perimenopause. Like, what is perimenopause? And this
like suggesting that the hormones are not stable.
Correct.
And so perhaps some of them, there were thin
They're
linings.
Going rogue.
Going rogue again. And the lining wasn't prepared and we didn't all rush in.
Right.
But we were all there.
Right. Exactly.
So,
exactly. And I also
And you weren't in hyper control because you were mom of 2.
Right.
So it should have been working, but it still wasn't.
It still wasn't. Exactly.
Did you do more testing? To look at autoimmune stuff?
So we did an autoimmune through the Beer Center that came back with some things. And off the top of my head, I don't even remember what came back, but it was basically you can keep trying to get pregnant. You're naturally, if you don't change this, you're going to keep getting pregnant. You keep having losses. And my response to that was but I've had one that was successful. Like, why is that different? And it was basically the probability of like, you can have another 16 losses and then maybe it will work. And then after you'd have another 16 losses and maybe that one will work. It was, right? It was just
really reduced down to math and statistical average.
Exactly.
Oh gosh, that probably.
For the type A person in me, that was not a good.
And the spiritualist that's in you too would have been like, that's just too random.
Exactly. Right.
Okay.
So eventually it was just, okay, I feel satisfied with we have 2 and this is the way it's supposed to be. My 16th miscarriage was pretty, that broke me in a different way.
Because it went farther?
It didn't go further, but I felt like I was really getting like universe speaking to me, that this was going to work itself out and that it will work with in terms of like even giving me a name, giving me like what it was supposed to be a girl and what she looked like. And I mean, it was like very detailed. And I didn't have that in other pregnancies, even in Aiden's pregnancy that was successful. And so when that did not work, and I chose to not have a DNC, even though my numbers came down, my body was still not releasing it. I chose to not have a DNC, and I was like, I'm just going to wait it out. My intuition is telling me my body will do it. It's going to take time, but I'm choosing not to take medication to release it or have a DNC. And it did. It took about 3.5 weeks. Even though my hormones were down, my HCG level was down, my body was really holding on to it. And I think that was me, my spirit holding on to like the confusion over why is the universe giving me so many details about this pregnancy, but yet it's still not working out. And the minute that I sort of, again, went to like that committed detachment, I'm committed to this is not working out, and detaching from that thought, my body did naturally release it.
The power of the mind, particularly in your case.
Exactly.
So
exactly.
Mind blowing.
Yeah. And I remember my husband saying, you need to go see Danica. She'll help you. Like she'll help your body release it. And again, my intuition was my body's going to do it on its own. It really will. And it was almost like I had to sit with this not living thing inside of me anymore to really understand what that whole 16 pregnancy journey was supposed to be about, you know?
Yeah. Your story, your journey is like, wow, no answers, but the minute that you release the control.
Right.
Again, it works.
Again. Yeah.
Okay. So,
but in a different outcome than you would expect, right?
That you wanted.
Yeah.
Right.
Exactly.
So then you go about your business and the quarantine starts.
Right. Did
you need to do any kind of like, the products were expelled?
All products of conception were completely, on their own.
Okay.
So you figure that 16 miscarriages plus Aiden's, that was a full term. So now at this point, I've been pregnant 17 times. And again, we thought, okay, if we want to expand our family, we will turn to adoption. Because at this point I was like, this emotional shop of fertility is closed after that experience.
That's where we parted.
Yep, exactly. So then quarantine happens, COVID happens. And I get this pretty intense throat infection, but it's a quarantine and no one wants to go to even your normal doctor, right? Everyone's scared to go anywhere. And so my doctor prescribed me medication just for amoxicillin or whatever for a strep throat, assuming that that's what I had. Took it, felt kind of okay, but 2 weeks later felt really miserable again. They prescribed me another round of it. Still kind of like it eased it, but never went away. Then fast forward, now we're at the end of December of 2020. So really deep in the quarantine. We're on the second wave of COVID here in Los Angeles. And I couldn't swallow my own saliva. I wasn't sleeping because I'd wake up every few moments to like spit out whatever was building up in my throat or in my mouth. And my husband finally said that I needed to go see our friend who's an ENT. I was like, no, it's okay. It's going to get better. And he's like, no, it's now at this point been a month and a half. Like it's not going to get better.
Chippy. Yeah. When you latch onto something.
I really do.
Stubborn
I
one.
know.
But that can work in your favor.
It can. Yes.
So this friend sees you, prescribes a different antibiotic.
The minute that I open my mouth, he's like, how are you alive right now?
Oh, boy.
And I had grown an abscess on my right tonsil that was blocking 2/3 of my airway. And the idea was that, if I hadn't have been waking up to spit out my saliva, I could have easily just turned my chin the wrong way and completely suffocated myself. Or the abscess would have burst and I would have gone into septic shock. I mean, it was insane.
Good thing Josh his stubbornness
That's
won
true.
out.
Yes,
in that
exactly.
One.
But again, it's COVID. No one wants to go into a hospital or whatnot. And because it was someone that I trusted, I let him go in and pull out the gunk from that
the
abscess and went back every few days to kind of keep getting it pulled out. And eventually he cut out a tiny bit of my tonsil to make sure it wasn't like the infection wasn't embedded into my tonsil. But he did all of that in office. But I would not have trusted some random ENT during this time to do that. Yeah. Plus, you figure my experience with doctors through my fertility journey, at the beginning, I was like just trusting anything.
Oh, yeah.
And then
so
it wouldn't
become more hypervigilant to that. Wow.
Yeah.
Okay.
So during that process, I got put on some high steroids. I was getting fluids every day. I was put on a higher dose of antibiotic that wasn't just amoxicillin. It was agmetin, which is a little bit higher of a attack. Within that's going to heal the wound, but my tonsils need to come out. Like, this is ridiculous. This is just going to keep happening, right? So now fast forward 2 weeks from there. So now we're in January 2021. And I go in for my tonsillectomy and got my IV in. I'm changing my gown. I'm walking to the operating room, and the ENT stops me and says, "We have to cancel your surgery." And I thought he was joking because he's a little jokester. And I was like, "Oh, you're so funny. No, I'm ready to do this. It's okay." He said, "No, you're pregnant." And again, I thought he was joking. Oh. And I said, "No, this is not a funny joke. Not about pregnancy. Like, you can't joke about pregnancy." Right. He said, "No, you're pregnant." Unbeknownst to me, which I'm sure is like common knowledge, but again, I'm naive. And I didn't realize, like, anytime you go in for surgery, they do test you for pregnancy as part of the multiple urine tests that they do. And so right away, I just like crumbled because I'm assuming this is going to be another loss. Mm-hmm. And Josh and my husband and I had already talked about, like, if we were going to grow our family again, it would be via adoption. We were done trying to have our own biological children. The trauma of it, we had, gone through couples therapy now during COVID, and we had kind of processed our whole 11-year journey. Right at that point. And that was the choice we were making. And we didn't even know if we were wanting to have, expand our family to a third child. But if we did one day, it would definitely not be something that I would be carrying. So here we are.
Because things were out of your control.
Things were out of my control.
Yes. Oh my gosh.
And, it was to the point where they're asking me, like, "Well, when was your last cycle? When was your last first day of your menstrual cycle?" I'm like, "I don't know. I've been dealing with the throat thing for a month and a half. That everything else was like second fiddle. I couldn't even tell you how,
that
like,
we
the last time exactly. That became the running joke of, like, for the last month and a half, you've had a throat abscess. How did you have sex?" But anyways, that's a different story.
It's a different podcast.
Yeah.
Yeah. So was the beta HCG level pretty high?
It was high. Ultrasound, you couldn't see, there was nothing to see. So we were clearly too early. So then I had to do the whole process of going back what was recommended to me to come back every 3 days, which is what we did.
Did you go to Dr. Beck?
No. So
your OB.
I just went to my OB because again, I'm like, I'm not going to try to support this in the way that I normally do. It's just
control it.
Exactly. So, normally though, right, when I do find out I'm pregnant, it's like every 3 days I go back for blood work and for an ultrasound so we can track the growth or lack thereof. And so went into my OB, got blood work, confirmed that there was a positive beta, and ultrasound showed nothing. And she said, "Come back in 3 days." And I said, "Absolutely not. I am not coming back in 3 days." And I said, at what week in my pregnancy will it be either we see a heartbeat and it's still viable, or it's too late in the pregnancy. There's no heartbeat. There's no way this heartbeat is ever going to show itself. And so she said 8 weeks. I said, "Great. I'll be back at 8.5." Mm-hmm. And so I just sort of leaned into, I think I did accept going on some like estrogen and progesterone because I was like, I will.
Because was the lining thin?
My lining wasn't thin, but it was sort of let's just pump me up with things that have worked in the past.
Yeah. You're a mom of 2.
Mm-hmm. It's COVID.
Yeah.
We're quarantined.
Right.
Uh-huh.
Exactly.
Yep.
So,
Mm-hmm.
so that's that other piece. You weren't overworking, or were you teaching dance?
I was still teaching on Zoom, but it was still a little different. There's not this commute.
Mm-hmm.
It was stress in a different way because all of the pedagogy was different.
Yeah, the logistics.
Yeah, exactly.
Mm-hmm.
But I think physically in my body, yes, it was not as stressful as when I'm teaching 20 something classes a week and fully dancing through them.
Yeah.
So, went back at 8.5, fast forward now to 8.5 weeks, and there's a thriving heartbeat and fully baby in there, but you could see
like
the profile.
Gummy bear stage?
Even more.
Oh,
more.
Okay.
Yeah. Uh-huh.
Mm-hmm.
And that is now my Olivia, who is now 2. And so through that whole, first, honestly, into my second trimester, it was still like, is this really happening? Like, also, this is defying any sort of medical, right? I wasn't tracking a cycle. I wasn't trying to get pregnant. Like, this is a very interesting, I just had this very traumatic 16th loss. And I had told myself my husband and I had decided we're done trying on our own. Like, this is not, why is this? So in a way, I was a little bit struggling with, oh my gosh, this is happening. And oh my gosh, why is this happening? This is not, I was not prepared for this. Yeah. Right. But at the same time, we kept hoping that this little nugget would live despite the odds of previous pregnancies. And so that's where her name comes from. Her full name's Olivia Hope, but we call her Liv. It's because we had hoped that she would live and make it to the other side.
Beautiful.
Mm-hmm.
And the pregnancy progressed.
It was
normal genetics, obviously, at the NIPT.
Correct.
Birth.
I ended up having a C-section, planned C-section. At this point, my OB, along with my doula, after kind of communicating together, we decided having a planned C-section was the safest, given how many DNCs I had, given how many just uterine procedures I had in trying to figure out our fertility journey. And because I had a C-section with my first, who was a larger, they called him large for gestational age. He was a larger. So they're like, this might be the best decision, which in hindsight was.
Olivia was a big baby too.
She wasn't a big baby. Actually, she was pretty normal or average, I should say. But it took a while for my bleeding to stop. Like, they kept me in recovery a little longer than normal. And my intuition, obviously I don't know this for a fact, but my intuition is if I had tried to have a VBAC, I think I would have had a much harder more trauma.
Yeah,
for sure.
Because there's an element of needing to release control, to let the cervix open and to get through that.
Right.
That's another discussion. Right. So she's 2. Did you feel like your family is complete?
Oh, 100%. It felt not even real. It felt like, again, when we had decided we're not going to try anymore, and if we want a third, we'll think of doing adoption again. But even that was a big if. It felt like my family was pretty complete there. And what's funny is I say that, and I can hear my husband saying in my brain right now, because he said it a lot the past few months, of like, you always had this tug, I think, on your heart that it was not complete. You kept trying to tell yourself that it was, because you felt like that was protecting you from disappointment again.
Right.
He said, but you kind of always knew that it wasn't. And so when Olivia was born, and then I felt this very sense of completion. It's like, oh, this is what it feels like when parents say, no more, this is how it is, right?
I remember having Kira and Jack in each arm, and I said, Dan, quickly get the camera, because right now I feel like this is complete and I know it's fleeting, but take the picture right now.
That's funny.
And I have that picture, and I do think of it, and I remember exactly that feeling. So
exactly.
Then life changes and stuff.
Sure, of course.
Then you start realizing there's other stuff you want and lack. In that moment. Yeah.
And Olivia felt like this sort of unexpected completion of our circle.
Right. Yeah.
And I remember my mom, especially for the first year of Olivia's life, she would come over and she said, you have such this calming peace about you. And I kept saying, because I know that she's this she's like my last one. And like, it feels right? This feels like this is the end of this fertility journey. This is its last chapter. Not to say that there's nothing else to write about, but in terms of that journey, this is like it. And not in a disappointing way.
Finished. 3 and done.
Right.
Or
third act.
18 and done.
Yep. Yeah, right. Because that would have been my 18th pregnancy.
Right.
And even when I gave birth to Olivia, I'd have nurses who weren't even assigned to me come into my room because they just couldn't believe that I'd been pregnant 18 times. And they really wanted to hear my story and like get a sense
Are you so
of like
tired
what that
of
was.
telling it?
No.
Oh, okay.
That's what's like fascinating. But I think it's because I was meant to tell it.
Yeah. Right. So before we get to this one.
Okay.
There needs to be like, the obvious message is, ladies, don't think that you need to control it or crack the case or figure out what it is and then like control for that.
Right.
It's sort of like allowing. Remember, like, I'm sure it's on one of those Post-its, the mantra, I allow the necessary shifts to occur that are in the highest good of everyone involved, right? Which really kind of fits in here, right? Like maybe Aiden wasn't ready for those 5 years to have a sibling or whatever, or maybe you're not meant to know why.
Right.
Or was the situation corrected?
Right.
As now this happened. So when you think back, it could be now or before you got pregnant with this one, when you reflect on it, where do you land in what it all was? Just divine design?
I mean, I think it is heavily divine design, but I think even throughout that sort of mentality, that it was all supposed to happen because there were so many learning opportunities that I would not have been given the option to learn. And not just learn opportunities about fertility, but about myself, about my relationship with my husband, about how to parent, about just life, like lesson opportunities to learn that I implement now. And yeah, I think it's a journey I was supposed to have to learn those life lessons.
Yeah.
And more so, even though it's hard to think about it through this lens in a way, but I was meant to have that journey, to share my journey for others to hear it.
Yes. You're talking to somebody who wrote a 33 chapter book, right? And each of those 33 chapters is a spiritual concept and a story that I witnessed. And my own story was woven in through there. My own story that involved helping other people but figuring out these spiritual concepts. So to your point, so you had 18 or 19. I had 33, but they were things that I felt at least a temporary triumph over. An ability to be patient, an ability to sit in the not knowing, an ability to trust the process, right? Like those kinds of things.
For sure.
And then chapter 34 or 33 is like, prepare for a breakthrough, or something about readiness and this readiness factor. I think somewhere I was like, 33 freaking chapters, that should be enough.
Yeah. Yeah. That's funny.
That should be enough to be able to have a kid, mother a kid, and to actually publish that book, to give an offering to the world, some way for them to see their own story and to see that it's not just like taking the right prenatal,
right,
or whatever the different things are, eating an avocado or whatever, like,
Sure.
It's a bunch of letting go. It's a bunch of different choices and different things, right? But there was this sense of completion that I had of like, okay, 33. It's a Jesus number, whatever, so like, okay, I'll cut it there. So now we all got to know what happened.
Yeah.
You are pregnant now.
Right.
You're 24 weeks, 6 months in. And so,
and
24
about to be 42.
Yeah. Turning 42 years old in June. Yeah.
Mm-hmm.
So, I mean, God forbid, if something were to happen, she's old, she's developed enough at 24 weeks. Like This is your fourth kid.
This is my fourth kid.
How did she come about?
Yes. So
it's a he? Oh, how cute.
It's a boy.
Okay.
It actually, how did it come about? I mean, in the beginning of November, I had an intuitional hunch that possibly I was pregnant again. But I kept pushing it off thinking, no, that's not right. Because in September, I had gone a whole hormone panel that had confirmed that I was in perimenopause. So at that point, my irregular cycles and some of these mood shifts that I was experiencing and interesting weight shifting on my body, that it was all kind of by definition lining up with perimenopause. So beginning of November, when I thought that perhaps I was pregnant again, I just kept pushing it aside thinking, no, this is what perimenopause must feel like. Of course, it's going to feel kind of similar to pregnancy because it's all these hormones that are going wonky. Exactly. Yeah. And then right before Thanksgiving, I finally decided to take a test. Came back positive and kind of freaked out again because I'm like, oh, here comes another loss. Why is this happening again? And again, we weren't attempting to have another child. But because my cycles were irregular, it was really hard to also track when that window to stay clear from or anything, right? And so kind of did the same thing, went to my OB to get my blood work that confirmed it, chose to not have an ultrasound right away, waited until I think this time week 9. And here we are again.
Oh my gosh. And it's the same OB?
Same OB. Okay. Yep. And this time I'm on progesterone, but not estrogen. We didn't do any of the other things that we had done with Olivia or with the previous pregnancies.
Right. When I was pregnant with Jack, I didn't need any supplemental progesterone like I needed with Kira.
Okay.
It's weird, getting older and the pregnancies being different.
Interesting.
And you getting stronger from having the kids. And that's one phenomena. Sure. This is so varied, right?
Right. Exactly.
So it wasn't for the people who were listening to be thinking, wow, this woman, she's just trying to build this massive family.
Mm-mm.
It's this was meant to be.
It was.
So does this one have a name? Are you
not quite?
Not yet.
Not quite. Yeah.
So what do you want to tell people who are listening that need some hope right now?
Yeah. I just really encourage to really tune into your intuition and allow that to guide you in what your next steps are, and to trust that the way it plays itself out is the way it's supposed to, whether it has the outcome that you expect or not. And I think for me, a big vital piece of my journey is practicing committed detachment, for sure. Because it releases that, again, that control that you have over something. And then I felt like I was able to really enjoy the journey. A word that came up in our work together was this idea of joy. Yeah. And not waiting for something to happen in order for you to feel that joy.
Right. I remember that conversation. Yeah. Yeah. That it's a choice.
It is.
Because it is what it is what's going on. And then how we choose to accept it is another layer. And then what we do beyond acceptance, right? Because you can accept your situation as your lot in life and then have kind of a negative outlook, a little cloud over your head.
Right.
Or you can accept what it is and then keep looking for where there's the beauty and the joy and all of that stuff.
My tagline is a little bit of even when it's hard to find words of thanksgiving, that you're still finding the joy in that space.
Yeah. Yeah. It's good. It's really good. It's really good to see you again. It's
Same.
really good to see you.
Thank you for letting us
pregnancy.
Yes, thank you. It's such
it was fortuitous because you just came walking down the hall here at Well People, and that was unexpected. And then the pregnancy. So
I think I rounded the desk, and suddenly you're like, "Wait, your belly."
Hold on a second. Hold up. Well, thank you so much, Chippy.
My pleasure. Thank you for letting me share my story.